So when I was 7 years old, my family became Catholic missionaries. We joined a group of priests, sisters, and laity, and we were called to go to the Philippines, and we spent about 8 years of my childhood there, where I kind of was enveloped into the Catholic faith and grew up with priests and sisters around me as family. So growing up in an underdeveloped country kind of created a desire within me to go into the field of medicine to help people, to serve them by becoming a physician. So between undergrad and medical school, I met my husband and started our family. We are now blessed with 5 beautiful children. And during medical school, I realized that there's going to be a lot of challenges, and I started to become concerned because of my Catholic faith and how I was going to become a family medicine physician and treat women's health needs without prescribing birth control. So I ended up being blessed with being exposed to NAPR technology and the Creighton model up in Rockford. We were lucky to have a medical consultant at that time that I ran into at a Catholic Medical Association meeting, and was able to learn that I didn't have to just say, no, I don't do that to women, and I could actually give them an option for other things I could help them with. When they came to me with their women's health issues, with irregular menstrual cycles, with painful periods, that I wasn't going to I didn't have to just say no to them and go somewhere else. And then I was blessed to find OSF as I graduated and found them and their openness to accepting me into their family as a physician and someone with a strong Catholic faith. So a little bit about OSF. The Sisters of the Third Order of St. Francis was founded in July of 1877 by Mother Crossie and Bishop John Lancaster Spalding. Their mission was to serve the sick and the poor in Peoria. Today, the sisters continue to serve actively in the OSF Healthcare Ministry. Sister Judith Ann is the chairperson of the board of directors, and Sister Diane Marie holds the position of president, and Sister Michaela is executive vice president of OSF Healthcare, who is here today. So one of the things with OSF is that we really focus on bringing forth our mission and our vision and our values through our everyday practice of seeing patients and caring for them. So our mission, being in the spirit of Christ and the example of Francis of Assisi, the mission of OSF Healthcare is to serve the persons with the greatest care and love in a community that celebrates the gift of life. Embracing God's great gift of life, we are one OSF ministry transforming healthcare to improve the lives of those we serve. With our values being justice, compassion, integrity, teamwork, employee well-being, supportive work environment, trust, stewardship, and leadership. And this kind of speaks to where our women's services have gone, to say that we're part of that transforming healthcare with our women's services. So, OSF Healthcare has grown significantly over the past several years. Currently, we serve over 780,000 patients in 126 locations with about 20,000 mission partners. We are mainly in Illinois, as you can see, with different regions, our western, central, eastern region, and our northern region also includes a hospital up in Michigan in Escanaba. So, July 2014, the Sisters Governing Board directed OSF Healthcare to find a viable alternative to the current option, allowing physicians within the ministry to create a limited liability practice for the purpose of prescribing contraceptive and related methods to patients outside of the OSF contract. So they are very passionate about this work and looking into these other options. So the next slide is going to be Sister Diane Marie, president of OSF Healthcare, who was present when this first started, kind of speaking to this intent and the importance of that undertaking.
I'm Sister Diane Marie, president of OSF Healthcare, and it's my honor to help share our ministry's experiences with the Humana UK Conference. About 6 years ago, our religious congregation, which sponsors OSF Healthcare, decided to take an intentional and system-wide approach to developing a structure to support best practices around natural family planning and fertility care. With over 500 employed physicians and many other clinicians, we needed a trusted and easy way for those providers to refer their patients for care. It also needed to be fully aligned to our Catholic identity and our system's mission to serve with the greatest care and love. We know we already had some good things started within OSF. For years, parts of our system had physicians and advanced practice nurses working in the natural family planning space. But we didn't have a single, all-encompassing program system-wide. These individual programs also weren't easy to navigate, and we didn't have a unified knowledge base, either externally or internally, of what was available. So like any good thing in need of a solution, we created a committee. I was asked by my sisters to help lead the effort to develop a structure to support best practices in natural family planning and fertility care, to ensure that what would be developed was a solid option for our patients and physicians, one that was scientifically backed up as well as true to the faith of our Catholic Church. I have to say, when God wants something, He makes it happen. And the mission partners of OSF who joined our committee were not only committed to the why, but also the how. Together, we worked to dig into the processes within our electronic medical record. We structured our recruitment efforts, provided better education, and added resources, and so much more. After 6 years, I can honestly say we aren't fully there yet, but we have been able to make big strides in creating a natural family planning program that encompasses our entire system. We've become good at overcoming challenges, dealing with setbacks, and making tough decisions. I'm proud of our OSF team. With my sisters and in my role as president, we support their efforts and ongoing focus to serve God and our patients with the greatest care and love.
So in the resulting women's health and fertility care services, that's the progress that's been made in a short period of time kind of shows in this manner of that the number of providers who have a limited private practice has decreased from 21% in 2013 to just 10% in 2017. And under the leadership of Dr. McShane, then the president and CEO of the OSF Medical Group, a new Natural Family Planning Advisory Council was formed. This group was made up of clinicians and other key mission partners, employees within the ministry with the express purpose of improving availability, accessibility, and promotion of evidence-based educational, restorative, and procreative health care for women and couples. So this is the second video of Dr. McShane, who was there at the beginning when this process was created as well.
I'm Jerry McShane. I'm a physician, and I was the leader at the time. The sisters asked us to develop and operationalize a very important asset of OSF healthcare, that being the natural family planning activities, and to recognize this was our gift of life for the sisters. Prior to that, OSF Healthcare, our integrated healthcare delivery system of 13 hospitals, 1,000 providers, physicians, and nurse practitioners, had many people who were active in natural family planning. They were recognized nationally, they had gone to school, they were credentialed. It was about putting all that together. And in a delivery model, it made sense for the physicians on the front line. I believe society at large, including physicians and patients, have less information and less knowledge than they could have. And that's one of the reasons why this particular activity has been so important, because it increases the knowledge of our physicians, our providers, and our patients. And so young women who grow up in our culture today are presented with only one option, and that is oral contraceptives or contraceptive method, which we oppose morally. And I believe that that's who comes for healthcare, and those individuals come for healthcare. We had to provide a service that all physicians and providers could see as a service, and we made that known through educational activities, one-on-one marketing efforts to say to these individual practitioners, hey, we have this service that we can provide that provides Catholic principled, morally sound activities in terms of fertility care and natural family planning. This is something that sisters really set as a goal for us, and we're still on the active journey of attaining that perfectly, but we're well on our way.
So there were 5 work streams that have been established. The first one being the CARE model, to create a strategic vision, structure, and implementation plan for the development of a robust offering of procreative and women's health services that is scalable across the ministry. Marketing and communications was the next work stream, to enhance the awareness and communication of these procreative and women's health services in the communities we serve. The next one was community and diocesan interface, to create a collaborative interaction that most effectively coordinates the shared resources of OSF healthcare in the diocese to advance the awareness and increased utilization of procreative and women's health services to support the culture of life in the communities we serve. And then the culture of life, to create awareness of NFP-related issues and advocate for policy that supports the culture of life in collaboration with the Governmental Advocacy Division of OSF, collaborate and communicate with the USCCB NFP office to assure alignment and consideration of its interests. And last but not least, the work stream of clinical education, to create educational opportunities across all aspects of procreative and women's health services, creating resources to enable implementation of the CARE model, creating awareness to promote utilization of services and enhance demand, create awareness of alternatives to the limited private practice policy, leading to its obsolescence. Now, as we have grown and become more developed over the past few years, we have worked to design a leadership model around this as well, to enable us not to be siloed outside of our primary care practices and our medical group as a separate service line, quote, but more embedded into our primary care practices, so that we have incorporated into everyday workflow, but still have leadership surrounding it to provide support, resources, making sure that there is people around that have ability to help, because this is not common knowledge in our medical fields. So there's not always the answers right there in a family practice setting, but to make sure that we have that leadership available to answer those questions and be resourced. This team currently is made up of me as the director, the physician director, as well as a clinical coordinator, a manager, and also an educator. This team will then assist in making sure that our frontline clinic mission partners have the resources and help that they need to embed this into the practice going forward. So currently, this is a map of our fertility care locations. As far as you can see here, we've got one up in Cherry Valley, which is right near Rockford, in Escanaba, Michigan, in Ottawa, Pontiac, Peoria, Galesburg, Bloomington, and Alton. So what our goals are is when we create these fertility care locations, that this is made up of a fertility care practitioner as well as a provider, whether it be a family physician, an OBGYN, or a nurse practitioner that has been trained through the medical consultant program. Because we have based our fertility care services and our women's health services around Creighton and the NAPRA technology. All right. So in talking about that dyad relationship, in our clinic setting, for example, I have a clinic, I'm the one in Galesburg. I work directly with a fertility care practitioner. So when we get a patient coming into the practice, we have different ways they come to us. In one way, it may be the patient just seeking to learn how to chart and may have the desire to avoid or achieve a pregnancy, and they'll get connected with my fertility care practitioner directly to start charting. Other times, they may not even know about NAPRO and Creighton, and they have no clue what that terminology means, and they'll come to me because they have irregular cycles. I'm family medicine, and so I'll see them initially and then refer them to my fertility care practitioner to get charting. And then as that relationship with the FCP is developed, then she will come back to me after 2 to 3 cycles of charting. But prior to that visit, the important communication piece occurs between the fertility care practitioner and the provider, so that you have, or I have knowledge when I'm seeing that patient of what was going on in that chart ahead of time, kind of have a plan in place. The fertility care practitioner has a lot of insight into what's going on in that patient and her life. And so it kind of develops a sense of trust with the partnership that we have in the practice. And then after seeing them, then I have them return back to their fertility care practitioner and continue that communication after I've seen them with follow-up plans, labs that I'm planning on ordering, so that there's that ongoing communication within the clinic to make it smooth for them and provide the best care possible. Kind of keys to successful collaboration include that communication piece, because with patients, they want to make sure that they don't have to recite the same story over and over again, that you know you're communicating, that they feel like there's a trust between the team of that. The other piece is that the entire office needs to have some familiarity with the language and the terminology, from the front desk staff to the triage nurses, to know that when the patient's calling in, that they're not getting that, huh, what, Creighton, what is that? Because that does happen occasionally. So as we all enjoy some feel-good stories, kind of the next slide shows some little stories of patients throughout our ministry that have had some great experiences. And one thing I'd like to note is that at the beginning of this first story is they first heard of NAPRO technology was through the diocese. So that collaboration with the diocese was so key in making sure that we're all a part of the same team. So Brooke Billiter in Byron, Illinois stated, "My story with NAPRO technology began when my husband and I went to Natural Family Planning Seminar that was hosted by our diocese. The speaker was talking about varying types of infertility and what causes them. It wasn't too far into the seminar when I looked to my husband Jake and said, 'This is exactly what I have.' At that particular point, she was speaking about PCOS. I had been having issues ever since puberty, which had gone misdiagnosed by multiple doctors for 8 years. But 45 minutes into this seminar, I felt as though I was finally getting answers. I started seeing Dr. Lim at OSF Medical Group at Cherry Valley, so he's a family doctor up in Rockford, in Cherry Valley, and was diagnosed with PCOS. From that point on, I was on a hormonal treatment, but still wasn't cycling regularly. So Dr. Lim suggested I should have an ovarian wedge resection procedure and referred me to a NAPRO surgeon. I underwent surgery in November 2014. Within 2 months of trying to conceive, we found out we were expecting and now have an extremely healthy, happy 4-month-old son. Without the NAPRO education at our Natural Family Planning Seminar, I would still be infertile with no answers in sight. I carried full term and now have the greatest blessing in the world." So another story was from Carla in Oak Park, Illinois. And this is an example of how widespread this can be. We don't practice near Oak Park, but she had first heard about the OSF Women's Health and Fertility Care through my church near Chicago as part of a family planning program for marriage preparation. I started working with a NAPRO coach and began charting my natural cycles with Creighton. Some charting irregularities were detected, and my coach recommended I contact Dr. Stalling. After some initial laparoscopic procedures, an extended 13-hour endometriosis removal surgery in 2014, later that year, my husband and I found out we were expecting a baby and have a beautiful boy named Jackson. With infertility, it's easy to feel hopeless and disappointed, but Dr. Stalling restored my hope. Before experiencing the OSF Women's Health and Fertility Care, none from previous doctors had given me an accurate diagnosis. And then she went on to thank us for all of us, even if we weren't directly involved. Every little bit of effort helps patients like me. And then one final story here. Josh and Tiffany Noel of Morton were married in 2005. After 6 years of marriage, the couple realized starting a family wasn't happening naturally and began having concerns about their fertility. In 2012, Tiffany and Josh were referred to a fertility specialist. Tiffany underwent several rounds of very taxing and invasive, yet unsuccessful fertility treatments. A laparoscopic surgery identified stage 4 endometriosis. In fact, her gynecologist told her it was the worst she'd ever seen, and that the only way they could conceive was $20,000 worth of fertility treatments. But then Tiffany's coworker gave her a life-changing recommendation coming from someone outside of the system. Visit OSF Women's Healthcare and Fertility. Tiffany underwent a 9-hour surgery to remove most of the endometriosis and began charting to uncover abnormalities. And this led to a hormone imbalance being discovered. And in 2015, the couple welcomed their baby girl, Lily. So it's always good to hear these kind of feel-good stories as we go through our challenges every day with developing this women's health services, because that kind of refreshes us, renews us to continue our growth and our efforts in this. So one of the big parts of our services is our education program. Through the guidance of our Creighton instructor, Paul Quartz, we actually have kind of a grow your own fertility care practitioner program. And we have been able to educate our own fertility care practitioners as well as others around the area that are interested in getting the training. This has kind of enabled us to be able to grow these dyads through our ministry, to be able to supply our providers, our physicians, and nurse practitioners with a fertility care practitioner, which I think is really key for the support of the practice. Another part of our system is education of our OSF providers and mission partners. So as I had mentioned before, the language of Creighton and NAPRO isn't as well known as it should be, as we don't get it in nursing school and medical school all the time. So we have really put a lot of effort into yearly education online learning modules, bringing it to our meetings to educate our providers about what this is and what it is to offer. So instead of thinking of our ERDs and our restrictions in Catholic medicine as being negative or not being able to provide services, of thinking of it as a different way to provide services, and that we do have options for women that are struggling with things. We are involved in grand rounds. In Peoria, there's the University of Illinois, so we are involved in their residency and providing yearly lectures there in the medical school and the nursing school. And then a little bit of, as far as with Paul Quartz, we have done 3 cohorts of the fertility care practitioner program and have produced 11 fertility care practitioners with that. So another component that is very important in the success of the program, as kind of witnessed by those patient stories, is our collaboration with the local diocese and the communities that we serve. So with this, OSF is important with the involvement of the diocese as it builds the relationship between our communities, churches, clergy, allowing exposure to what we have to offer. We have ongoing different events, mother and daughter teas, different presentations that we give throughout the ministry. And as far as developing a relationship with the diocese and the local priests, it's very beneficial with the practitioner, because then you have that go-to from both the side of the priest and the diocese as well as the practitioner for getting patients to be able to reach those resources. And then we currently have a really close tie with the Peoria Diocese, as we have a nurse practitioner, Cecilia Saunier. She is also a medical consultant and a fertility care practitioner that provides our resources in Bloomington for us, but she also she has a dual role as she is working in the diocese as leading the ministry of pro-life. And we're going to hear a little bit from her today.
I am Cecilia Saunier. I am a nurse practitioner. I am in a collaborative role with the Diocese of Peoria. I am the director of Respect Life Ministry, as well as NACO medical consultant for OSF Healthcare. In order to help OSF, the Bishop gave his blessing to this beautiful ministry and mission that the sisters had. And basically it was to promote and spread throughout the diocese, which is quite large, the services that OSF has for women and couples who are trying to achieve or avoid a pregnancy, as well as those that are having problems with their fertility. It's also letting them know that there are services within our Catholic healthcare system that will help them have alternatives to contraception, to in vitro fertilization as well. So recently we had the 50th anniversary of Annevay D conference, where we had all the natural family planning methods available. We also have mother-daughter teas, where we reach out to 10 to 13-year-old young girls, and in there we teach them about the changes in their body, and that they don't have to resort to birth control to control any issues that they may develop in the future. The beauty of that is we're not only speaking and educating the girls, but also reaching out to the mothers as well. It's very interesting as well that we have pre-Cana and Christian sexuality workshops, and within these workshops we promote as well the natural methods for planning their families. We do have the resources of OSF through our webpage at the diocese, through Marriage and Family, as well as through the Respect Life webpage. And there we have educational videos that explain each of the methods to our patients. I think what I'm doing has been such a blessing for me in particular, to be in this unique role of being able to be like a bridge between our Holy Mother Church and our Catholic healthcare institution. And because I am such a believer of the sisters' mission as well as our church's mission, it's sort of like I'm in this role to evangelize and re-evangelize, and once again bringing that church's teaching with the science together, because they both can be seen as complementary and congruent in what they both are doing. The beauty of it is we even reach women that have had abortions. And so the beauty of that is that there is a place in the aftercare treatment where these natural methods would benefit, and to continue their healthcare for the healing process. OSF also offers some psychological counseling as well. So once you start in one area, it's like a domino effect. It covers the whole journey of life.
So now I would like to speak to our vision of growth and our ongoing plans towards the future that we're currently working on implementing. One is in relation to our primary care resources. So we are currently ongoing with our education with all of our primary care physicians, reaching out to them with different health stream options, opportunities to get more education on this, so they have more of an understanding of options outside of contraception, to help women with their health issues that occur, and to have a better understanding of this. We also then, with our medical consultant management education, an ongoing relationship with more advanced NAPRO to go that one step further, initially diagnosing, but then also ongoing management of patients that are continuing to struggle with infertility, managing those hormone levels, and having ongoing education around that with our medical consultants. Because then there's also then e-consult services that come into play. So through our Epic system for our medical records, we can have providers who are not medical consultants the primary care providers reach out to us as medical consultants with questions. If they encounter women that have women's health issues, they're not quite sure how to manage that. If they, as we're trying to encourage them to reach out to us more and even get the training. Of course, our dream would be to have everyone trained in this and be able to treat their women right as they come in the door. But before they're able to do that they can reach out to us through Epic with a message, a question, a consult, to see what that next step is that they need or what they could do to help their patients. And so that currently is in process as we add medical consultants to our team to be able to share that pool of resources. The other element that we have recently added in the past year is telefertility services, so that for the women that are wanting to learn how to chart that don't have medical issues, they can reach out to our telefertility services, as our geography can be spread and it can be a burden for our patients to drive back and forth frequently. We're coordinating that so that we can maintain the quality of the Creighton model, but also look to the patient as to making it as convenient for them as possible as well. And then as far as the practice of our naprotechnology surgeons, we're looking to further develop that practice by adding that practice into our system, kind of as a central referral source, to develop that as we have a big referral pool from all of our medical consultants to be able to source that practice to provide full and complete care to all of our patients in the OSF ministry. I have been with OSF as a physician for the past 6 years, and from when I started and the growth that I have seen over the past 6 years, I feel like has been tremendous. It's been very exciting for me to be a part of it, because when I first was in residency, it was just pretty much the Rockford practice. I was in residency, I connected with that, and then Peoria started to grow. And then it's just kind of starting to blossom, and it's so wonderful to see that, because it truly is just such a great way to help women and their problems. And when I see that excitement in the patient's eye, that the answers are coming, that they're feeling better. I've had several experiences, and they're not huge stories, but it's simple things, as a woman coming in and they've been trying for 18 months and I get them charting and they're pregnant 2 months into charting. And they're like, how did this happen? Well, and it renews and refreshes you as you face challenges through this women's health service line. And it's exciting to see where the future will lead. One other thing that I hadn't added onto this kind of bullet points would be research. We've mentioned that quite a few times today, and I'm very excited to hopefully move our program into that as we continue to build, to be able to network with other health systems, to really start getting volume of patient care from all these charts that we're seeing, because we could get so much data from this, especially with our computer systems now, to be able to track the numbers and the volume. So I'm excited to see what comes from that as well as we move forward. And I think that's all I have. Thank you.